Good evening, everyone. I hope I'm audible and visible. Everything is okay. Okay. So today we are going to discuss about thyroid hormone synthesis. So a lot of questions are coming from. It can be clinical question, it can be long question, it can be short question. But the concept is today's concept is synthesis of thyroid hormone. So if you know synthesis in one cell, you can understand the whole concept. So we will discuss only about one cell. What is happening in the basolateral side? What is happening on the luminal side? So first of all, let me discuss about the basolateral side. So which channel is there on the basolateral side of one follicle? Because right now we are discussing only about one follicle. So if you have seen the diagram given in Ganong, Guyton and all the books, on the basolateral side, there is a symporter. And that symporter is sodium iodide symporter. So it is taking iodide from the blood. From the blood, it is taking the raw material of thyroid hormone, and that is iodide. So iodide is taken from blood from the basolateral side from sodium iodide symporter. This iodide will get inside the follicle. Okay, so now we are having iodide in the follicle. So next question, who will throw this iodide into the lumen? Step number 2. Step number 1 was on the basolateral side, we have sodium iodide symporter that is causing influx of iodide. Okay, iodide. But since this is happening in the lumen of follicle, so who will throw this iodide into the lumen? Answer is pendrin protein. Pendrin. Pendrin. So it is the pendrin protein that is throwing iodide into the lumen. Okay. And if I talk about the clinical thing, if there is a mutation of pendrin, it can cause Pendred syndrome. Pendred syndrome, it causes goiter and sensorineural deafness. Okay, come back to the main topic. So iodide is thrown into the lumen by pendrin protein. Now, this iodide will be oxidized. There are 3 steps in the synthesis in the lumen. Number 1 is oxidation. So first of all, iodide will be oxidized in the lumen. Iodide will become iodine in the presence of enzyme TPO, thyroid peroxidase enzyme. This is going to convert iodide into iodine. This is going to convert iodide into iodine. Now you have iodine. And in the follicle, in the colloid, you are having a precursor hormone, and that is thyroglobulin. Thyroglobulins are nothing. They are simply ring of tyrosine. They are simply ring of tyrosine. So first process was oxidation of iodide into iodine. Second is called as organification of iodine into thyroglobulin. So iodine will be organified into thyroglobulin, and this is again controlled by same enzyme TPO, thyroid peroxidase enzyme. Step number 2. Clear? Step number 1 was oxidation. Step number 2 is organification of iodine into thyroglobulin. And when they are organified, either they will become MIT or they become DIT. What is MIT? Monoiodotyrosine. MIT is monoiodotyrosine. What is DIT? Diiodotyrosine. So it will form into MIT and DIT. And this is again the same process, organification. So first was oxidation. Second is organification. Third, your favorite, it is coupling. Okay. The third process is coupling, which is again controlled by TPO, thyroid peroxidase enzyme. In coupling, what happens? If T2, diiodotyrosine called as T2, if T2 combines with T2, it becomes T4, thyroxine. If T1 is if T1 is early in the chain and T2 is late in the chain, it will form T3. And if DIT is early in the chain, MIT is late in the chain, it becomes reverse T3. Once again, so the third process is coupling. If DIT, diiodotyrosine, combines with DIT, diiodotyrosine, it becomes T4, the precursor hormone. If MIT is early in the chain and DIT is late in the chain, it will form which hormone? T3, the active form. T4 is the precursor form, T3 is the active form. But if DIT is early in the chain, MIT is late in the chain, it will form inactive thyroxine called as reverse T3. So first was oxidation, second was organification, and third is your coupling process. So oxidation, organification, and coupling, all of them are controlled by a single enzyme. What is that enzyme? That enzyme is called as, yes, please tell me. It is called as TPO, thyroid peroxidase enzyme. So after oxidation, organification, and coupling, we have three hormones. Three hormones are there: T4, T3, and reverse T3. So raw material we have taken was simply iodide, and finished product will be T4, T3, and reverse T3. These all hormone will be phagocytosed inside because of endocytosis. It will form phagolysosome, and it will be taken again in the blood by endocytosis. So blood has given to the thyroid follicle only iodine. In return gift is what? T4, T3, and reverse T3. So T4, T3, and reverse T3 is the reverse, the return gift of the follicle to the blood. The gift was iodide. This is how these three hormones are formed by thyroid follicle. Now, T4 is called as precursor hormone. Half-life is very long. It is not that active. T3 is called as active hormone, and reverse T3 is called as inactive hormone. Okay. Now, maximum is T4. In the blood, maximum will be T4, then T3, and then reverse T3. But active form is always T3. So now you will ask me how T4 will be converted into T3. The answer will be deiodinase. 5-deiodinase. I mean, T4 can be converted into either T3 or into reverse T3 by a single enzyme called as 5-deiodinase. T4 is the precursor hormone. T3 is the active hormone. Reverse T3 is the inactive hormone. This is the synthesis of thyroid hormone. And if you want to discuss, if you want to tell anyone the main function of this hormone, in one word, answer is BMR. Thyroid hormones are going to increase basal metabolic rate, BMR. How? Okay, how? See, every cell in your body, they are decorated by a pump called a sodium, potassium, ATPase pump. And the fuel of that pump is your thyroxine. So that pump will be active in every cell of your body only if we are having enough thyroxine formation. Otherwise, we can have hypothyroid. And if it is excess, we can have hyperthyroid. Okay, so this is about senses. Now, one more thing I want to add because we have 2-3 more minutes more, that this thyroid follicle is controlled by anterior pituitary gland, which in turn controlled by hypothalamus. So pituitary gland is releasing TSH, thyroid stimulatory hormone, to control thyroid follicle. Okay, these all the steps are controlled by TSH. And this anterior pituitary gland is controlled by hypothalamus, okay, via TRH, thyrotropic releasing hormone. So TRH, TSH, and then T3, T4. And that will become pre-T3, T4. So in hypothyroid, when T3, T4 is less, it will cause feedback increase in that TSH. So in hypothyroid, TSH will be more. On the other hand, if patient is having hyperthyroid, okay, T3, T4 is more, automatically TSH will be less than normal. Okay, so this is it for today's session. Hope to meet you again next Monday. As we know, every Monday and Friday, and intentionally I have taken this class to be very, very short, just to, inculcate interest in physiology. Okay, and this is just a revision. Already we have discussed a lot about everything. This is only a revision class, not class, it is only a small session. So all the very best. Bye-bye.